Welcome, everybody, to the podcast series on innovative healthcare solutions sponsored by the Conference and Consulting Actuaries, or as we refer to it, the CCA. This is a series of interviews with actuaries and other professionals focused on delivering innovation in healthcare. I'm sure you're going to enjoy this session and all the great discussions we plan to have highlighting the interesting people, products, and services designed to drive a better healthcare system. Now, these sessions are offered to provide insights about what is transpiring in the ever-changing healthcare environment in which we live. For those of you who actuaries watching this, these sessions are not necessarily designed to offer continuing education credit, but each viewer can assess for themselves if it meets the criteria for such credit and then go ahead and take advantage of that. My name's Ed Podlowski. I'm president of Morningstar Actuarial Consulting, and I'm also chair of the healthcare community of the CCA, and I'll be your host for today's discussion. I'm really delighted to be joined today by Dr. Tim Church. Tim is the Chief Medical Officer at Wonder Health. Dr. Church is a clinical thought leader and research scientist who has authored hundreds of articles on exercise and obesity. Tim earned his MD and PhD at Tulane University. He also has a Bachelor of Science degree in kinesiology and holds a master's in public health. Tim, thanks for joining us today.
Thanks, Ed. It's a real pleasure.
Now, Tim, just for the benefit of our viewers here, I should explain Wonder Health is spelled without the E in it, and or as I think you like to think of it, it ends in DR, which is the abbreviation for doctor. Can you, maybe for the benefit of our viewers who may not be familiar with Wonder Health, just give us some insights into what you're all about and how you differentiate yourself in the market?
Yeah, absolutely. And it's funny because very binary. Either you really know who we are or you've never heard of us. I'm going to first call us a weight loss program, and I'm going to say we're not a weight loss program. The main differentiator is generally we are going to be provided by your employer. So you can go on the website and go buy it, but we're not competing against the Weight Watchers or the Nooms or the Jenny Craigs. We are billed as a medical claim. That's really, really important. So generally, I can name all the big employers. You would know most of them. I'd probably get in trouble for saying their names, but you fly on them, you search things with them, they're all big employers. So generally go to pay bills of claim. But the most important thing is I joke all the time, we're not a weight loss program. We're a mental health program that pretends to be a weight loss program. Weight loss, you are not that number on the scale. That does not define you. And that's the core of our program is really helping people create healthier, more rounded, more balanced lives. And guess what? That'll reflect on the scale. And, close to 250,000 people will use the program this year. So that's mainly what we do. And you can imagine in my job, I deal with actuaries every day. So I'm really excited to be here, actually.
Well, hey, Tim, can you speak a little bit about the science behind your solution? I know you and I have chatted in advance of this, and I find it pretty intriguing, and I think our audience would enjoy that as well.
I think the key is science. These come from huge federally funded NIH trials. So if you look at the big behavioral trials, all these acronyms are going to be nothing to anybody, but diabetes prevention program, weight loss maintenance program, look ahead. These are multi-million dollar longitudinal trials where you really, just to simplify, you try like 60 behavioral tricks. Well, what ends up, there's about 10 that really matter. And that's kind of the core of what we do is these behavior, like realistic goal setting. What happens when you fall off the wagon? Understanding the role of emotions in your eating, understanding the role of sleep in your eating. Things like it's so much more than just caloric balance. Like there's 500 calories in that muffin. Okay, great. You know what? I can figure that out with my phone. But that's not really what it's about. It's helping people understand really their body and how it works and their relationship with food. But again, all of it grounded in real science and real psychology.
That's perfect. We've all been dealing with this pandemic. And of course, we've all heard of COVID-19 referring to the amount of weight gain people are experiencing during the pandemic. I'm sure that's had to have an impact on your business. So how has that affected your offerings and your approach to member services?
Affected might be the understatement of the century. we're in a different world. We're all going to be in a different world. And let me tell you what's going to happen, actuaries. We had this COVID-19 thing, and it's an epidemic. It's led to 2 new epidemics, which are going to impact us for a while. And one of them is mental health. We're hearing a lot about that. It's getting a lot of press. The other one, which is going to bubble up sometime next year, it's the metabolic epidemic. And what do I mean by that? Excess weight, prediabetes, type 2 diabetes out of control, hypertension out of control. So, everybody missed their doctor's appointments for a year. On top of that, they weren't sleeping well. They were gaining weight. They were drinking more alcohol. They were inactive. All those things have metabolic consequences. And if you think about a risk curve, a normal distribution, our whole risk curve in the United States is shifted to the right. Anybody who was moderate risk is now either high risk or got the condition. Anybody who was low risk is now moderate risk. So that's the metabolic, I call it the metabolic tsunami that's coming at us. And, fortunately for us, we already talked about mental health before the COVID thing. So it's really been an easy transition for us. But I keep warning all these leaders, said next year, your pre-diabetes rates are going to go up 30 or 40%. Your metabolic syndrome rates are going to go up, same thing, 30, 40%. Your hypertension rates are going to go up. And all that is going to translate into medical costs. So yeah, it's impacted us quite a bit and continue, in a positive way, because we're there to help people. We're the perfect solution right now for what's going on. But yeah, it's impacted us in a great way, like everybody.
Yes, Tim, maybe talk a little bit about how you drive engagement with plan members, because obviously that's going to be one of the key to driving value in programs like these.
Well, okay, I want to pull a trick on you. And
right.
We have to sell the plan first, and we have to sell the company first. So that's our first sell. So I would, how do we engage them? And it's going to be in all the things actuaries love. When it comes to anything behavioral, you have to deliver on an ROI. You have to. You can't just say, oh, hey, we have 93% attendance. Oh, good for you. When we talk about ROI, we break it up into 3 different ROIs. One's a financial ROI, where, if you're working with a big enough population, you can actually demonstrate a financial ROI. 2 would be clinical ROI, which is like, are you lowering blood pressure? Are you improving cholesterol? Are you actually lowering weight? And then 3, believe it or not, is cultural ROI, which I think are like quality of life measures, which again, you can measure that. You can go get things like the SF-36. And so the first group we got to engage are the plans and the companies, and often the actuaries. And to do that, you got to have metrics around those 3 ROIs. Financial ROI, clinical ROI, and cultural ROI. And I keep saying these days, if you have any behavioral program, I don't care if it's a smoking, quit smoking program, it's a weight loss program, it's a mental health program, you better bring data. You better not just show up and say, hey, we have this huge engagement rate and everybody loves us. It's like, no, we're past that point in our history now. But then when you go to the individual level, when you go to the employee, the question you just asked me, first thing you want to do is approach it from a point of grace. I know that sounds weird. Approach it from a point of give yourself a break. People know they're carrying too much weight. People know they're sedentary. People know they're not eating good. You want to say to them, hey, you know what? That's okay. Life's a full contact sport. But come walk alongside us and we're going to teach you some skills. And you know what? You're not going to do perfect, but we're going to help you get better every day. So first and foremost, don't take things away. I'm not taking away your barbecue. I'm not taking away your deer stand. I'm not taking away your family events. And you know what? Why don't we start by you giving yourself a break? Come walk alongside me. I'm going to teach you some skills, and you're going to be able to use those skills every single day.
You mentioned ROI, and I know you have a calculator out on your website for employers. Obviously, it'd be remiss with this audience and their kind of interest in some of the data and numbers, but can you talk a little bit about that financial value, kind of the magnitude of it, how you go about calculating that? And I know you've done some fairly in-depth studies around that too, to prove that value. Touch on that for us a bit.
and you know, and everybody who's watching it knows, ROI is, I mean, you talk about vapor. I mean, it is, even when you get it, you often can't get at the mechanism of how you got it. And so I'm the biggest ROI skeptic ever. We do it multiple ways. We have multiple calculators. So one calculator is, hey, if someone's got high blood pressure, this is the added cost. If they've got high triglycerides, prediabetes, and then if you reverse those things, you just do a before and after, and you can estimate the potential savings. You know, it is what it is. You take the available literature. What's so fascinating about that, we use that for years. It actually matched the real data. We didn't do it. A huge carrier did it. They did a longitudinal study with us, 2-year study, 23,000 people. And, our program's typically $250 a year for a person. I'll come back to that in a minute too. There's an important point there. And people who used our program, the ROI was 2.1. So for everybody in our program, there was over a $500 savings in medical costs. Again, real claims matched. So you had, matched a group that did it, group that didn't do it. And then within that matched on age and gender and all the risk things you do. And then, the next question is, well, how did you guys save money? Like, what was the one line item? And no surprise, there wasn't any one line item. It was all of them. It was a little bit here, a little bit there, a little bit there. But the bottom line, the ROI was a 2.1, which makes me happy. Because if it had been a 6, I'm like, that doesn't make sense. Okay, this is a behavioral intervention. This isn't like bariatric surgery or something where it's a behavioral intervention. And so I would expect it to be, between 1.2 and probably 2.5-ish. So at 2.1, I'm like, yeah, that's okay. It makes sense. They ran it 4 times. They all pretty much the same results. But that was really fortunate that we had a partner that had a big enough database, longitudinal data, and tightly controlled, and their actuaries ran it. We didn't. So, I like to say there's 2 ways you can do a financial ROI. One is you do some tricky modeling, and 2, you're fortunate enough to have some big real claims data and do it right.
Yeah, there's tremendous value there, obviously, but you're not even touching on some of the other value that may come out of this. The productivity gains employers get, the ability to manage absences and presenteeism, et cetera. I'm assuming those aren't components of your ROI.
So that it is actually, that would be.
Well, I apologize.
Not financial.
Of the financial ROI, right?
But you attack those differently. And the other thing I would expect from a modern behavioral program is published data. So we've actually published 5 papers in peer review literature, not 5 white papers, 5 published papers, peer reviewed in the medical literature. We looked at metabolic syndrome, hypertension. We looked at the value of repeating the program. We actually did a really, really cool paper on education level because we're E-based. We're all E-based. And everybody's like, well, how do you do with truckers? How do you do with manufacturers? So it ends up 1/3 of our population, their education stopped at high school. And that 1/3 just does just as good as people who graduated college and people who have graduate degrees. And I mean, that to me, again, is if you've got the data, put it out there. Don't tell me you do good in this group. Show me you do good in this group. And then you talk about these other isms, presenteeism, absenteeism. Our 6th paper actually was programming till about 10 o'clock last night on this one, is quality of life measures. How's your mood? How's your back pain? How is your stress? How's your sleep? And it ends up that, we really improve quality of life measures, kind of no surprise. But, if you can't tie them to a financial ROI, at least publish them and get them out there in the public domain.
Yeah, Tim, curious how your clients, the employer groups that take advantage of your services, how are they tracking the success of your solution on an ongoing basis?
Great question. Demand outcomes as an employer. I mean, demand outcomes, demand reporting. We do reporting. We do almost probably too much reporting, I say jokingly. So right now we do reporting at 3 months, 6 months, and a year. What do we report? Everything. Literally everything we have that is of value that I can put into a graph that makes sense is what we would report to our customers. So within that, we have retention by week. Every week, how many of your employees are still in the program? Weight loss by week, by gender, benchmarked against other companies. And then we show weight loss in their higher risk groups because we know what their risk factor profiles are. And then lastly, we're going to show those quality of life measures, you know, and not lastly, actually, lastly, you have the quotes from the participants. And we get thousands and thousands of quotes, and man, some of them will tear you up. If they don't tear you up, then I don't know. And so, but you have to have that, no, it's not, you have to have that transparency. You know, we used to kind of do this reporting where it's like, okay, well, how do we keep the reports simple? How do we keep them kind of pain-free? And what's the minimal amount of data we need to give, which is kind of silly because we had a ton of data, but that was our thinking, like, let's keep this simple. And I realized over time, they don't want it simple. They want the whole story. And that's kind of where we are. We take every bit of data we can, we make it hopefully digestible, present it back to the customer.
Tim, I think earlier you touched on the fee for your program, $250 per person, I think. And I think you mentioned something I wanted to go back to. I wanted to make sure I gave you that opportunity to do that.
And I appreciate that because this is important. It's not $250 for starting. We get paid per class. If you don't take the class, we don't get paid. And I think that's a really important, you know, foundation, not just for weight loss, really for any behavioral program. Upfront fees are ridiculous. If you get paid $1,500 for a 1-year class that the 80% of people are going to drop out, that's ridiculous. And it tells me you don't trust your program. So I'm a really big believer in, you know, pay as you go. So on average, people do $250, $280 a year in classes. But again, we earn that one class at a time. Which is smart for weight loss because everybody's on a different journey. And some people do 6 classes and they lose a ton of weight. They kind of got it. Other people, they want to be with us every week of the year and they'll do 52 classes. You know, it's just, you're all on a different journey. So you kind of can't force people into a stereotype when it comes to weight loss.
Great. Well, Tim, before we close up here, I just want to make sure that if you had any other comments that you wanted to make that I didn't get the opportunity to touch on with you up to this point.
No, I just want to kind of double down on my original comment. You know, again, the audience here is actuaries. You know, you heard it here first. The metabolic tsunami is coming. This is going to be a thing. I don't think anybody's really looking for it right now, but it is coming and we're going to have to deal with it. Yeah,
I'm there with you. I think with what's going on with COVID, it's really exacerbated this issue. And I think the trends that employers are going to be seeing once we kind of all come out of this pandemic are going to be tremendous. So I appreciate your thoughts and insights on that. Well, Tim, one last question for you, and this maybe gets a little more to a personal level, but you know, if you didn't take up a career in the medical profession, what would you have done?
Me?
Yeah, what would have been your passion if it wasn't in the medical profession? Although you're very passionate about the medical profession, I see. So, well,
I'm an artist too. I mean, that's my art right there.
Oh, cool.
So that's a loaded question. I would spend most of my days doing art and doing jujitsu, beating people up.
Oh, wow. Oh, very good. Well, I'd like to encourage our viewers who participate in our healthcare community to continue any discussion about the insights that were shared here on that platform. Again, if you're not a member of the CCA, you may want to consider joining to not only experience the benefits of community platforms of the CCA for informal discussions, but also some other great benefits our members enjoy. Tim, thanks so much for being here today and really appreciate you sharing your insights about Wonder Health and what you're doing in the innovative healthcare space. I'm sure our audience benefited from the time you shared with us today, and I know I thoroughly enjoyed it.
Thanks, Ed. Really appreciate the opportunity.